So we kind of talked about this briefly, but we certainly can create a custom template for you.
Okay.
A lot of our system is going to be really flexible to really kind of meet the needs of your organization. And I'm going to try to point out those customization capabilities for you within the program. But my guess is that the one thing that's going to be mostly different from what you're going to see today will be the actual form that
Sure.
you use to actually take your notes. But everything else is going to be really close to what you're seeing today.
Okay. So let me just ask you real quickly before we get started. When we go to adapt that, how much time does it take to adapt the program to what we need?
So
Just in general.
a standard enrollment, because you'll be using the billing, I would say 3 to 5 weeks is a standard implementation timeline. The biggest component for that is actually the billing piece. Now, depending on the complexity of the templates, that could kind of push you a little further out. But once we take a look at the templates, we'll be able to give you a timeline for completion on those as well.
Okay. All right. So that leads me to another question. Right now, we are billing strictly the state. We don't do any outside insurance billing at this point. We do a little Delta Dental and Care Credit, but that's of course through a third party. So as far as the billing goes, that is something that's like out for us a little, because we're not picking up a lot of insurances. Right now, we're primarily taking state. Would that change the timeline for installation?
When you say, are you saying state?
Yes, state insurance.
Are you referring to like Medicare?
No, Medicaid.
Medicaid. So Medicaid is actually one of the payers that unfortunately is the reason that it's a 3 to 5 week timeline. Medicaid, Medicare, and the Blues, those 3 payers actually do take about 3 to 5 weeks for the billing setup. And the reason for that is that they require that they actually respond to your request to send claims electronically, whereas 99% of the payers don't have that requirement. So the Medicaid actually will take about 3 to 5 weeks. Now, are you really trying to find something pretty quickly?
We are, but we're on a deadline for February to report meaningful use. I need a program that can report meaningful use for us. Right now we're in year 2 of the meaningful use. So our biggest problem has been e-prescribe, and there's one other point that we're having a tough time with that we have to, of course, adhere to.
And will you be attesting with 2 systems, so using some of your old data and then some of the data from RxNT? Is that kind of your plan?
Actually, we have not been using any system here.
Okay. So you're really trying to find something pretty quick.
Yes, and that's going to be adaptable to later on. Because so far, every system that I found, Jessica, although it goes through the cloud, it won't go past year 2 for meaningful use. Your system is the only one that I have seen so far that actually would do that. Is that correct?
Yeah, so we are compliant with all of the meaningful use requirements to date, and then we're also working on our certification components for the new MIPS requirements, which is more related to Medicare. So Medicaid, really nothing's changed in there.
Oh, that's fantastic! Really, it is. Okay, I'll keep my questions to a minimum. Go ahead.
Oh no, that's perfect. Just kind of so you know who we are. We've been in business for over 18 years. We were actually founded as an e-prescribing company. So I heard you say that that's one area where you really are hoping to improve. And so that's one area where we're also really strong. And I'll certainly make sure to show you that today as well. We are certified for sending controlled medications electronically. Do you see that happen quite a bit with your office, or are you primarily going to need?
No, actually, we are doing controlled substances. We administer pain medication, not from our location, but through script. But Washington state law right now, they have to hand deliver. I've noticed that some providers are being able to have the ability to e-prescribe if they register their signature and the whole bit for it. So that is changing. But the thing is that we have to show that we're electronically prescribing. We do prescribe antibiotic, which is, of course, not a C2. And so that's the one that we want to be able to keep track of for our meaningful use. We only have to report I believe it's 60 days, 60 or 90 days. It's all we have to report. Now, it's not that we don't have the information. We do. We just need to be able to have a system to put it into.
Yeah, of course. One thing to point out, actually, all 50 states are, in fact, certified or have passed legislation allowing you to prescribe controlled medications electronically. I'm just pulling up this map here. There are not very many prescribers in your area actually taking advantage of that. But in the state of Washington, you can send all of your medications, including C2s, electronically. And about 90% of the pharmacies in your area will accept that as well. It's about $25 more per year. But that's just something that you can kind of keep in mind. It is illegal. And again, all of your medications, C2 through C5s, can be transmitted electronically.
Gotcha. Okay. That's great.
So if that's something you want, we can start you out with that. We can always add it later too.
Okay. Is that through a third party? I mean, is that regulated through a third party?
E-prescribing?
No, I'm sorry. I was thinking something else. Go ahead. I'll ask that question when we get there.
Okay. Just so you know, we do we've built, and all of the products that you'll be seeing today are, in fact, our XNT products, from e-prescribing to our electronic health record to scheduling and medical billing. Okay. We are located in Annapolis, Maryland, and really the biggest component to that is that when you talk to a member of our training or our support team, you will talk to someone in Annapolis, Maryland. We won't route you to a call center. You'll be talking with product experts.
Okay.
All of our programs are certified, and so that does require some third-party audits. So we do have to go through DEA audits for our electronic prescribing of controlled substances. We work with Hostway. They are a third-party data storage center. So they actually store the data, and they go through audits to maintain HIPAA compliance for all data storage. So all of the certification requirements are in place. We even have e-prescribing apps for your iPhone, iPad, and Android devices. So you can use our product on the go. And then we're going to include training and support in your license fee. And training is available Monday through Thursday from 9 a.m. to 6 p.m. Eastern time. I'm sorry, that support is available Monday through Thursday from 9 a.m. to 6 p.m. Eastern time. And from Friday, it's available 9 a.m. to 5 p.m. Eastern time. Okay. And then our training is also scheduled within those hours, but we'll make it available to you as many times as you need to ensure that your team is successfully using our XNT.
That's fantastic.
This is completely related to prescribing controlled medications. We can talk about that a little bit more down the road, but that has to do with e-prescribing. I'm actually going to pull up one more screen because I did want to talk to you a little bit about meaningful use in the RxNT product. You will have this made available to you when you become a client. And basically, it's just kind of a little choose your program guide. So if you wanted to attest for Medicaid, you click here, and it's going to provide you information depending on what you're trying to accomplish. So you've got the RX&T system instructions, but then just overall instructions as well.
Oh, fantastic.
So just some information that we've tried to make available to make the process a little bit easier for you. And so I'll send you this. I can actually send this to you after our demonstration, but I wanted to point it out just briefly.
No, that would be great if you could. I'd appreciate it.
Okay, I'm just making a note, so remember to send it to you. All right. So from here, I'm going to go ahead and move into our scheduler. This scheduling solution is actually customizable, and it can be adjusted to really meet the needs and the requirements of your practice. In this specific example, we have some checkboxes. This is just showing all of the person resources. You can schedule and manage resources such as your provider, but also for yourself or other nurses that might be in and out of the office and you want to keep track of their availability.
Oh, that's fantastic. Yeah, there's not a lot of us. We pretty much can keep track of ourselves right now, but that doesn't mean later we didn't need it.
And you know, sometimes you forget when someone's going to be gone for an afternoon. It's nice to have it, you know, centrally located, but a lot of people just manage the provider's calendar, and that's certainly fine too.
Okay.
Material resources, this could be anything from a room to an x-ray machine, really anything that you want to set this up for that you need to reserve. And it can be as simplistic or as comprehensive as you want it to be.
Okay.
And then we have our appointment template types. These will actually be customized and completely set up based on your specifications.
Okay.
So what that'll allow you to do is say, okay, I'm going to schedule an appointment for 3:30. And when you click on the time slot, we'll ask you, well, what patient are you scheduling for? And I'm just going to say it's Kristen Miller currently. If the patient that you're scheduling for is not in the system, you can add them right here by clicking on this green plus button.
Okay.
And when you select the patient, we will go ahead and default your primary resource. You can associate somebody else, so if someone's going to be helping with their teeth cleanings, you can book them. If you're booking a room, you can book that as well. But the appointment template type, this will actually be something that you say, okay, I want my new patient visits to be 60 minutes. Maybe you do a, annual follow-up, and that's going to be 30 minutes. Or maybe you do a cleaning, and that's 45 minutes. These really can look however you want them to. And then you can also book recurring appointments if necessary. So very flexible, just going to be determined based on what you tell us you want. And then you can always make changes to that as well.
Okay.
And let me go ahead. I'm going to pick this. So once the calendar is on, or the appointment's on the calendar, we do allow for you to actually do automated patient appointment reminders. They can be sent via text, via phone call, via email. Now, there is an additional charge for that. It's a $2 monthly fee for a phone number, 2 cents for every text, 4 cents for every phone call. If you wanted to go with an email, it's a $2 a month email address, and then 2 cents for every email. And those reminders will go out automatically to your patients, reminding them that they have an appointment.
Okay.
Now, oh, go ahead.
So email was what?
It would say, this is just a friendly reminder, you have an appointment scheduled with us tomorrow at 1 p.m. Pacific time. Please call, enter phone number if you have questions.
How much was that though a month?
Oh, the email is $2 a month for the email address, and then 2 cents per email.
Okay. Fantastic. Okay.
A few other things I was going to point out. We do have a copay report. This report is going to let you know of any copays that you'll need to collect for that day. We have an eligibility report. This report is going to let you see any eligibility that's been run and any alerts associated with it. So because you'll be using our billing solution, we will run eligibility for you every morning at 4 a.m. for all of the patients on the schedule that day.
Okay, so there's where my question came in. The billing solution, is that through a third party?
It is all done through RxNT software. We do work with medical billing partners. So if you guys didn't want to manage the billing in-house, we could connect you with a third party. Well, it's not really a third party. It is just a partner of ours. You can choose who you want to partner with. We've got a full list of people that you could potentially work with to manage your billing.
Yeah, and that would be for private insurance, but not for the state, I'm assuming.
They typically bill everything from Medicare, Medicaid, private, even self-pay. So it's completely up to your organization. You can manage it yourself. It's a very easy solution to use, or you can outsource it and work with a billing company.
Okay. I see buttons that say next to your calendar weeks, month. What does that do? Is it going to?
Are you talking about? Is this what you're looking at?
No. Well, that may be related to the one that's just under your calendar.
These.
Yeah.
So these will say, let's maybe you're talking to a patient and you need to see them in 3 weeks. You just click the plus one and select 3, and it'll actually skip you right to 3 months from today.
Nice. Okay.
And if you wanted to go and look at 3 months ago, I mean, you could do that as well.
Oh, it'll go back too. Gotcha. Fantastic. Okay.
Yep. So the green or the plus is moving you forward, and the minus moves you back.
Okay. Fantastic.
And you can always go back to today by just clicking today.
Okay. That seems pretty self-explanatory. So up in the top right corner, that's actually just view what we want to see. If I wanted to see the full week, it would show me the full week.
Exactly. It's just going to adjust the way that you see the calendar.
Great. Okay.
And a popular one is actually the resource view because it breaks down all of your providers. If you wanted to manage it based on material resources, exam rooms, you could do that as well.
We're very, very simplified. We have 1 provider and 3 other employees right now.
So you could see the calendar for the 4 providers, or you may just want to see the calendar for 1 provider and not your employees. So completely up to you.
Gotcha. Okay. Let me ask you, up there in the top right-hand corner, it says Google Sync. Is that syncing the provider to the system?
It's syncing the system to the provider's email address.
Okay.
So the provider could say, all right, what appointments do I have today? And he could look at his, Google Calendar or the iCal on his iPhone and see what he's got coming up.
Exactly what he was looking for. Okay.
Perfect. And checking patients in is simple too. You'll just click on the actual appointment. You'll see all of the appointment details that we just created. You can also review and update demographic data. Cases or insurance can be managed here. If you ever need to do prior authorizations, that can be set up. Sorry, what was that?
We do quite a bit of that, Jessica. Prior authorizations.
You do need that?
Yes, we do that through the state.
Okay, great.
Certain patients, so we do quite a bit of that, yeah.
Perfect. And you can set it up by unit. So if it's a unit prior auth or if it's a number of visits. So it can be managed a couple of ways. And then, of course, this will be your Medicaid most likely. If you do ever start accepting commercial payers, you can set that up. Or maybe it's just a self-pay patient, and that's also going to be an option. So instead of health insurance, you would just select self-pay.
Okay. So down below there where you were showing the insurances, it shows primary, secondary. Does that self-populate in the system, or is that something we're entering in as we're entering in the new patient?
You'll go ahead and enter it in, and when you collect their insurance, you'll just say, okay, what, you know.
I see. Oh, gotcha. Okay.
And you'll enter their policy and group information and stuff right there.
Okay. All right.
We do run eligibility for you automatically every morning at 4 a.m. But let's say the patient's insurance was expired, or maybe it's a walk-in or an emergency visit that you guys are taking. You can always run eligibility manually, both by service type or by procedure code. And then finally, we've got the payment section. This is going to alert you of copay information. It will let you know of any self-pay information. We also provide patient balance. So this balance is actually going to be pulling from the billing solution. So you'll know exactly what you need to collect at the time of check-in. In this case, let's say $105. And maybe it's a check. Select the check. And right from the scheduler, you can actually accept this payment, and that will push the payment into the billing solution.
Okay. Okay, so let me ask you something, Jessica. With when we do our eligibility check in the morning, occasionally the patient will show in the state system as having a different primary insurance, that the state is actually secondary. Is it going to automatically, when it runs the eligibility, is it going to pick that up, or is that something we're going to have to catch ourselves?
So the eligibility is going to run for the insurance that you have in our system.
I see.
So if when you run the eligibility, there's a red flag or something that doesn't quite look right, then you could talk to the patient about it. But we do run it based on the insurance that you've added to the system.
So would it automatically, if there is a secondary, or it shows a secondary insurance for the state, it will flag it then for us?
Yeah, so let me give you kind of an idea of what the eligibility looks like. I'm going to, give me just a moment, I'm going to pull it up from a different screen. So I think that'll really be the best way to answer your question. It shows you, exactly what you'd be looking for.
I'm sorry if I stopped you in a process, but.
Okay, perfect. So, so this is actually the kind of information that you'll receive from the eligibility check. It's going to let you know the status, any deductible and copay information. You'll see if there's any co-insurance or anything like that. Okay. I'll kind of just scroll through these. But what you will see is that we're running it based on a specific payer. So we're not telling you which payers are associated. We're telling you, okay, this is the payer we ran the eligibility for, and this is the data associated with it. And you can run it by multiple payers, but it's really going to provide detail around the specific payer that you're running the eligibility for.
Okay, that was my question, because so we would just have to double check then some of these, because we don't find out until we run the state. and it'll kick back to us and tell us that there's another insurance. And usually we don't know right off the bat. And sometimes we don't even know at that time. Sometimes we find out at the point of billing.
A little later down the road.
Yeah. Unfortunately, it's not a great system. So I can completely understand doing this. It makes sense to me. So.
Okay, great. Let me go ahead and move us back to the scheduler screen.
Sure.
So once you collect the payment, you can accept it, and that's going to, again, push everything to the billing component. Any other questions about the scheduler? Does this seem like it would meet your needs?
I'm very familiar with this kind of scheduling. I've used an EHR before through another employment I had. And so this is reasonable, and I probably wouldn't need too much training on it because it's pretty self-explanatory. So
it is. It's very easy to use. So all of our products are tab-based, so you can actually access all of them at one time. So you can actually be in the scheduler while you're in the electronic health record. And I just made my screen a little smaller. Is that easier to see, or would you prefer it a little larger?
No, actually, that's great.
Okay, perfect. And what we're looking at now, this is actually our dashboard for a provider. And I'm currently looking at the e-prescribing component of the dashboard. And this is where you or your provider can actually review recent medications, and you can see the date and time in which they were received successfully by the pharmacy. If the doctor ever said, hey, can you queue up the medication and have it waiting for me to sign, you can actually queue that medication up. You can save it as pending. So at the end of the day, all the doctor has to do is review the medications and approve and void as necessary.
Oh, that's
It just
fantastic.
makes it a little bit of a shortcut for the provider.
Sure.
Some of our practices don't want to receive refill requests electronically, but we do allow you. You do or don't?
We do not, yeah.
Okay. I'm seeing more of that lately, so I'm just going to make a note of that so when we set up the account, we know how to do that.
Yeah, they have to physically come in to get a new script. So.
And that's very common. We do have the capability, but if you don't want to, we certainly will turn that off. And otherwise, you can review voided medications as well.
Okay.
Other things on our dashboard, and this is customizable, but one that's going to be pretty pertinent and important are the encounters component. And I have this kind of zoomed down, so when I hover over it, you can see exactly what it stands for. But here I can see all of my unsigned notes. And then I can also see notes that have not been released. Now, unsigned notes, that's anything that's awaiting the doctor's signature. It's not been finalized. Okay. Not released is something, it's a visit that's happened with a patient, but you haven't submitted it over to the billing component. So not released is your indicator that you actually need to release the encounter to billing.
Oh, I see. So those are pending files then.
Exactly. Yeah. So this is something that requires the provider's action.
I see. So I am looking at the provider screen then. He would have access to this.
I'm logged in as if I'm a provider with full access. Okay. Some administrators can access something very similar to this, but right now I am logged in as a provider.
No, that's fantastic. I just wanted to make sure that this is what he would be seeing.
Of course. And then we do have e-faxing. If you ever wanted to use it, it's basically like an email inbox, but it allows you to securely send documents and receive documents. So basically you can receive things, compose new messages, see what you've sent and archived. And then we also have labs. Do you guys ever do lab orders or results?
Yes, we do occasionally. We sure do. Yeah.
And which lab companies do you typically work with?
Typically it's inside.
Could you repeat that?
Insight, INCYT.
So depending on the frequency, you may just want to do paper orders and just upload the labs.
Yeah, because some very often at this point. So.
Okay. Let's say you get down the road 6 months from now and your lab volume is significantly higher. We do allow you to connect with labs electronically. LabCorp and Quest Diagnostics are actually included, but a lot of times the lab company will cover the cost of that connection. So if that's something that you want, we could certainly get that set up for you.
Okay. Is there an extra cost for that?
Not for LabCorp and Quest. For any other labs, there is a cost. It's $2,500 for a one-directional connection, so either orders or results. If you wanted it to be bidirectional, orders and results, it's $5,000. But I've never had a client actually pay that. Typically, the lab company does.
I see. Gotcha. Okay.
But from here, we can access a patient's account. And to do that, you just go into the top right-hand corner. And let's stick with our patient, Kristen Miller. When I search for the patient by last name, all of the results will populate here. And all I need to do is actually click on the patient's name to open up their chart. Now, this can be very customized based on what you want to see. And the way that we do that is through the navigation bar. So if I click on this little menu configuration, here, let's see. Would you guys ever do any vitals?
We do charting, yes. It's not extensive though.
Okay, so maybe you do want to keep that up, and maybe you want to see
any immunization, right?
So you can actually customize this so when you click save, it's going to look a little different so that you're only seeing what you want to see. And what this does is it actually provides quick access to relevant information within a patient's chart. So starting at the notes section, this is actually a post-it note. It's more like, hey, just a reminder, this patient requests refills early, or hey, I spoke with this patient. She had a birthday yesterday, or whatever.
So Jessica,
just something.
Jessica, just let me know when you switch from provider, because that would have been my next question, but it looks like you're still in the provider dashboard. When you switch to from provider to front desk. So this is not generated from the front desk. This is the provider leaving a note for himself, correct?
This is actually going to be something that can be accessed by anyone on your team with access. Okay. So we have different levels, whether you're a provider or someone that's administrative that has access, or a nurse, for example. Yeah. So you can actually pick exactly what each person can do. So this could be a note by the provider, or by the front desk, or by a nurse. So completely up to you. But I am still logged in as a provider, but everything that I'm doing right now can be done by anyone on your team with access.
Okay, great.
You can also load patient documents. So if you wanted to keep track of old documents, you could attach those here. And it could really be anything, but all you do is click view and it's going to pull a PDF pop-up for you.
Okay, so let me ask you about that particular portion. Is that a scanned in document, and is it editable? Can it be?
It can be a scanned in document. So basically what you'll do is, once the document is on your computer or on a file where you can access it, you'll just click on this little green plus button and you'll choose the file, and it can be selected from anywhere in your system. We allow for documents, PDFs, zip files, Excel files, images. And all you do is select the file and you can give it a title. You can select a category. And these can be customized too. So if you have something that you want or something that you don't want, we can adjust this.
Okay.
And then you give it a description. So that's one way that you can get documents into our system. The other way is through the electronic fax. So you can receive documents via fax, and if you do, those documents will be attached here.
Okay. Because like I said, his form, he crosses out the teeth that he has extracted. And the form you just showed me is similar to the one he would use.
So we could do actually something very similar to this. It would be more templated, so the doctor wouldn't be writing on these specifically, but we would create a form with an image that he could draw on and cross through things.
Oh, that'd be fantastic.
When you do labs, those will be viewable here as results. The orders can actually be printed from RxNT as well. Again, depending on how frequently you do the vitals and the charting, the vital information will be available here. And maybe you're keeping track of something over a period of time. You can also do the charting associated with it.
Oh, that's fantastic.
Patient history, whether it's family, medical, surgical, social, that can all be easily accessed here. Same with your allergies. And anytime you document an allergy, we will run a real-time drug-to-allergy interaction check at the point of prescribing. And we do something very similar for the problem. So any diagnoses that you add, we will run a drug-to-diagnosis interaction.
Okay, so at the point of the reception for the day, will it flag the patients that are allergy?
So we only flag once you prescribe. And I'll show you that. Actually, I can show you right now. So our medications tab is actually where the medication will be prescribed from. And within this, we have several different tabs. We've got our current medications. So these are medications that you're aware of that the patient is actively taking. Previous medications are anything that has been generated out of the RxNT system, and we'll keep track of any discharged medications, any changes in the dosage.
Okay.
That's going to be visible here. We have the history. This history is actually going to pull patient history based on pharmacy fill data, meaning the pharmacy's actually filled the prescription, and on claims history, meaning the medication has been submitted to insurance to be processed by the insurance company. You'll get access to this anywhere in the United States. It does not have to be something that's been prescribed by your office. So just to alert you of the potential for doctor shopping, potential for abuse or addiction, that's really what this history tab is going to help with.
That's fantastic.
And we're able to access this based on a demographic match. So your patient's name, date of birth, address, gender, phone number allows us to access and pull this medication history for you. And then, of course, any voided medications, if something were to void, you could see that here. But regardless of which tab you're on, this Write Rx button will always be there. So what's a medication that you might prescribe?
Commonly, we do amoxicillin 500 milligram, and we do hydrocodone.
You said hydrocodone?
Yes, yeah. Mm-hmm.
Is that HY or HI?
It's HYDROCOD.
And I might need to go ahead. Oh, here we go. So you can do a partial search throughout our system, and anything here that you were wanting to prescribe, you simply click on it, And that's when we do the drug to drug, the drug to allergy, drug to demographic, and drug to diagnosis interaction warning. And if you see here, that's actually this little red tab blinking. And it's letting you know, hey, something's going on. And in this case, we've got some ingredient allergy interactions here.
Oh, wow.
And you'll see exactly what's going on here. This is another option or something worth reviewing, so we'll let you know that. And just because there is something adverse going on, it does not mean that you need to change your prescription strategy.
Yeah,
all you'll do is click create new SIG, and we're going to just remind you, hey, there is an interaction. What do you want to do? You can accept and continue. And maybe I'll just do this one. And I'll just say, let's do 5 tablets. We've got take 1 tablet daily with breakfast, 5 tablets. And maybe this is something that you would prescribe frequently. You can actually save this SIG the next time that you go to prescribe for this medication. This will be pre-defaulted for you.
And that's just by the drug itself, not by patient, correct?
Correct. It's by the drug. So you'll find this across all of your patients.
I'm sure he'll like that.
It's a huge time saver, and it's great to be able to set them up on the go, so you don't have to go set them all up, beforehand. You can set them up before you start actually prescribing, but it's nice to be able to do things as you start to progress and start to use the system. Just great shortcut.
Oh, that's fantastic. Thank you.
You can run prior authorizations electronically. We'll actually alert you at the point of prescribing if it's needed. You can document pharmacy notes. You can include a reason for the order. You can associate a diagnosis. You can even schedule this to be sent at a later time. But really, it's pretty simple. You're just going to input the prescription instructions. And from here, you can either add another medication or you'll continue on to the pharmacy search screen. That brings us right to the patient favorite pharmacies. We do save this for you automatically or once you've sent a prescription to a pharmacy for a patient, we will save that pharmacy information so that you don't have to search for it time and again.
Yeah, I see you have a prescriber favorite pharmacy. Mm-hmm. We do have out-of-town people that go through one particular pharmacy. Yeah, fantastic.
And these will be the ones that you most frequently use. And you can save 5, you can save 15, completely up to you.
I see. So as we use the system, it'll accumulate this list then.
So the patient favorites we save for you automatically once you send a medication. The prescriber favorites, these are actually going to be set up by you. So what's your zip code?
99204.
99204?
Yes, ma'am.
Okay. So you could search by zip code. You could expand the search by city or surrounding cities.
Oh,
and all you'll do is check 1 or 2, and you'll add them to your favorites list.
Oh, that's great.
There's one of them at the bottom.
That's great.
And here's the other one. And then when you're ready to prescribe, you'll simply click on the name of the pharmacy. We will provide you a prescription preview. You can still make changes. You can edit this as necessary. And this is really one of the big places in the workflow where what the nurse or somebody on your administrative team sees versus what the doctor sees. For controlled medications, a doctor is the only one who will ever be able to send them. So a nurse would be able to save as pending. Now, if this is just ibuprofen, you might give someone on your team the authority to send a medication on behalf of the provider, but the majority of the time they're being sent by the providers. And so when the provider clicks send, the DEA actually requires the completion of two-factor authentication. It's just the DEA's way of ensuring that the provider is in fact who they say they are,
right,
and that they're the one using the system.
right.
So the doctor will enter their login password or the password that they use to access RxNT, and the doctor will enter a one-time PIN. And that's really where this token comes into play. This allows a doctor to click this little button. They'll get a randomly generated PIN number, and the system knows exactly what PIN number they're looking for. So when it gets plugged in and the doctor clicks sign, it can actually electronically submit that controlled medication to the pharmacy.
Oh my, that's amazing. That's awesome.
And it completely, I mean, you can print out a copy for your patients, but then you don't have those controlled medications floating around. You know exactly that it's getting to the place where it's being submitted.
Yes, exactly.
Now for non-controlled medications, if I click send and I'm the provider, it's just going to send that medication. You don't have to complete two-factor authentication for, you know, something like ibuprofen.
Okay, so let me ask you this. With your system, he typically sends 2 prescriptions for each patient, an antibiotic and, of course, a pain medication because we're performing surgery. Would he have to do those individually, or will it send them both together if it was set up to do that?
Yeah, so let's say we're here. I just clicked edit prescription because I can easily answer your question by doing that. Okay. All you have to do is add drug, and maybe it's ibuprofen.
Okay.
I'll just do something simple. We've got a recommended SIG by the FDA. And so in this example, I now actually have 2 medications that I'm getting ready to send. I click continue. It needs me to give it a quantity. And that's going to, again, take me to the demo pharmacy. And here I have both prescription previews for me to review. And I click send. I will be prompted to complete two-factor authentication because one of the medications is controlled.
Yes.
But they'll both send at the same time.
That's great.
Any other questions?
No, actually, you're answering them as we go. I appreciate that.
I'm sorry, I'm having a little bit of a hard time hearing you. You kind of cut out a little bit.
Oh, I'm sorry about that too. Actually, no, you're answering them as we go. I appreciate that.
Okay, perfect. And then the final thing that I do want to show you today is the encounter section. And this is the component that I think is going to probably look the most different when you decide to get set up with RxNT, because we will create something that's custom to your organization. But I do want to go ahead and take a minute and show you how our encounters can be formatted and some features and functionality that I think might be pertinent to what you're hoping to accomplish. So I'm using the encounter form here, and I'll just leave this one open just because it has a couple of things that I think might be pertinent. One, review of systems, that may not really apply, but the Vitals plugin, this component is actually going to look just like the Vitals section that you have over here. And the benefit of leveraging plugins like this is that when I click Update Vitals, this is actually going to pull that vital in from your last visit. So you only need to change what's different. Same thing applies for your current meds, for your allergies, for your patient's history. The illustration section, I do want to point this out to you. Let me see if I've got an example. I think I have the illustrations turned off on this one. But essentially, if they weren't turned off here, it would just be the picture that you were talking about, and you can draw right onto it.
Yeah, the documents that he would need to fill out, sure.
Exactly. The diagnosis, you would want to use structured data for a couple of reasons. One, we pull the diagnosis over from your tabs on the left-hand side. And two, these are going to go a long way in actually helping you bill the claims that you're going to need to submit. And we've got a great ICD-10 coding tool. It allows you to search by an ICD-9 code. It allows you to search by a keyword. So if you were talking to a patient and telling them their diagnosis, what would be something that you frequently diagnosed?
Unfortunately, that's not the part that I would do. Can you hold just a moment just to...
Okay.
Roxanne, I just need a second. Could you give us a diagnosis that we would normally do? Just an average diagnosis for the patient.
So like a tooth code?
No, just give me, she's trying to show me the code.
Full bony extraction?
There we go. Let's do full bony extraction.
And could you, what was the first word?
Full bony extraction, yeah.
Is that, how do you spell that? B-O?
B-O-N-E-Y.
All right, so let's go ahead and search that. And what we'll do is we will actually provide you, let's see here.
But she's showing me that it's going that I can look.
Let me see.
Well, they're just looking for ICD-10. Still body's not finished.
It's not what is.
Let me look at it.
She's going to give us another one, Jessica. She says this one isn't particularly going to show up as a 10.
Okay, so it might be the complete bony impaction. I'm not sure.
It would be, but we don't have ICD-10 for those.
Okay, so it would be, but we're not currently using 10s for that. What are we using for that?
The CPT.
The CPT codes is what we're using for them.
Okay, perfect. So what our system is actually going to let you do, and it is a CPT code, but you'll just search like bony impaction or whatever you would need to, and we'll give you a plus sign indicator when you've actually found the highest level of specificity required for ICD-10 coding. I'm trying to think of a good example. Okay, here. So let's say in this case we've got a tooth avulsion. The reason I'm pointing this one out to you is because it actually does have an arrow, which means you're required to have additional specificity to actually show that you saw this patient and to get credit for it from a billing perspective. Yeah. And so when you see that arrow, we'll say, okay, answer a question. Is it an initial encounter? Or maybe it's a subsequent encounter. You'll just check the box. And what that's going to let you do is drill down until you've got one code that can be added to the patient chart.
Okay.
And then also you've got your plan and coding. All of this information really does pull together to create a standard note that you might be used to seeing. This actually differs significantly from one that I think you might use. I'm going to just show you two other kind of template concepts so you can see different ways that these are managed. This one is actually really a popular template. It's completely off specialty, but the reason I'm showing you this particular template is because instead of having everything in tabs, this actually is going to just pull everything into one form. So you just kind of scroll through it, and we can drop images in here as well.
Oh, I see. Okay, so up there I saw that the CPT code, there's a section for CPT code, so we could manually enter it in.
Exactly. So you'll just say, you know, whatever you want to bill, it's completely up to you. And when you pull it in, it'll just drop it into the list.
Oh my, that's fantastic. Okay. All right.
And then, you know, we've got something really simple too. So this can really kind of be flexible. We'll just really want to kind of get a feel for exactly what you're hoping to accomplish as far as your templates. But this is one where we've got a plan worksheet. And again, you don't have to do anything like this. We can customize it to really meet your needs once we get your forms.
And obviously, these are the ones that are fillable, editable, that kind of thing.
Exactly, exactly. So once we get your custom template created, you'll be able to come in and mark it up and say exactly what you're wanting to say. And I'm just showing you some so you can see how flexible the system is based on what you're hoping to accomplish. But once you've created an encounter and everything's set up, all the doctor will need to do, or someone on your team, is to click this little green release button. And that release button is actually going to release this encounter or the note to the billing software so that you can actually go ahead and bill for that and get paid for the service. We will pull in everything from the patient's demographics to the date of service, to the provider, to the diagnosis, to the procedure code. So really all you're going to be doing from that perspective is reviewing it and ensuring that everything looks good and submitting the claim. And I'll show you a little bit more on our billing solution, but before I do, did you have any other questions about the electronic health record?
No, but on the right-hand side here, you have this red X. Is that a delete?
So that little button can only be accessed by providers. So if something's not signed, we do allow you to delete it. But if you look at this little migraine, I'm not sure if you can see that. If you look at this little migraine option, there's a checkbox to the left of it, and the column is signed. That's where you'll know it's actually been finalized. You don't have the option to delete it. You can add addendums or something like that, but you won't be able to delete it.
Okay. So what is the blue icon there on the left?
So the blue icon.
Yeah, across from the, you've got 4 icons on there. One of them is to send it to the billing, which was the green arrow, but what is the blue one there? What is that?
The blue is actually a copy function.
Oh,
so what that does is it takes all of the details from a previous date of service and it'll move them into your newest or your most recent date of service. So you don't have to type the same information over and over again.
Okay.
And this one's if you're emailing something or faxing it. That's what that blue one is for.
Okay.
Here you can access the clinical summary. And for anything that's actually not been finalized, we do have a little folder. It just allows you to edit your notes and to finalize those.
Okay. So I have a question down here about patient documents.
Okay.
I'm assuming that's the patient education documents.
So we've got a few different options as far as patient education. Some are going to be associated with the diagnoses themselves. So when you actually have a diagnosis, right here, this will provide education. You just click on the little link and select whether you want English or Spanish. And we're going to provide information associated with that. Okay. And you can click and drill into additional information here as well.
Okay, so most EHRs, when you print the encounter for the patient, for them to take with them when they leave the office, it will provide, automatically will attach any patient education. Will this system do that for him?
It won't automatically do it. So you'll need to actually select what you want to see here. And we from here do allow you to easily print the document. so that you can give it to a patient. But because it's, it basically has a lot of drill down options. So it's not just like one form associated with the diagnosis. You might want to be explaining the CT scan, for example.
Okay.
And you can print it alongside of what you're providing the patient.
So that brings me to another point of the meaningful use. We have to prove that we're providing patient education to the patient. That's part of this second year. How does the system report that then? Because
so we keep track of every time you click on that link, and that's how we're able to report it.
I see. Okay, that was my question. Okay.
And then the other place that there's patient education would be associated with the prescription. So if you wanted to explain something to the patient here, we also have medication information here.
Okay. That's great.
Any other questions?
Nope, not so far. Great.
Okay, great. So do you guys anticipate that you would want to handle the billing component yourself, at least for the Medicaid?
Honestly, I'm just looking to see what our options are. At this point, we are doing it. I'd like to see. I'm sure he would like to see us eventually do that through everything through the system, basically.
Okay.
And is that an extra cost, though?
So if you're, I'm actually moving into the billing system now.
Okay.
If you're sending your Medicaid claims electronically with RxNT, you might qualify for part-time pricing if it's just Medicaid. Part-time pricing is anyone that sends less than 150 claims electronically. But let's say you start to
is that per month, Jessica?
150 claims per month.
Okay.
And how many patient visits does a doctor do in a month?
Let's see. Anywhere between, I would say 30 and 35.
Per month?
Uh-huh.
Okay, perfect. So the doctor certainly would qualify for part-time pricing. And since the total visit is about 35 per month, you could easily start accepting commercial through the RxNT system, and there'd be no additional cost.
Okay.
So the full suite of products, from scheduling to the electronic health record to the e-prescribing to the medical billing, is $205 per provider per month. That's going to allow you to send claims electronically. It's going to allow you to check eligibility electronically. You'll get your payments through ERAs electronically. And then, of course, you can upgrade to start sending to your commercial payers, and there'd be no additional cost for that. If you weren't looking at the billing solution and just wanted to get started with the scheduling and the electronic health records and e-prescribing, it'd be about $85 a month. But being able to send your claims electronically is a huge time saver. We allow you to submit claims both on your ADA dental forms and on a CMS 1500 form. So depending on which insurance you're billing, you can actually do both within RxNT.
All right, fantastic.
And then our system also allows you to print claims. So if while you're just accepting Medicaid, a few of your clients have asked you to print a claim for them, you can actually print that out of our system. And it's just a really easy way to help your patients out.
Okay, so this is the actual dashboard. This is for the claims or for the billing in general?
This is for the billing.
Okay.
Exactly. Go ahead.
That's all right. So up at the top, Jessica, you've got reports, statements.
Correct.
And that must be payment ledger, right?
Yes. So we've got ERA, so that's electronic remittance advice, your patient ledger, your aging report. But what we kind of boast in the RxNT system is a 4-step billing process. So encounters, which matches the same language that you'll see in the electronic health record, is your first step. Once an encounter is finalized, you've reviewed it, everything looks good, it then becomes a claim, which is your second step. And we're fully integrated with the clearinghouse, so we can actually keep track of the statuses of all of your claims. We've got our insurance payment screen and our patient payment screen. So third step is insurance payment, whether it's Medicaid or commercial down the line. And then finally, you collect your patient payments as well, which is your fourth step.
Okay.
And then the dashboard, it's just letting you know, okay, you've got $600 over 151 days. It's going to let you quickly identify this Blue Care Medicaid has 450 outstanding that you've not yet collected. So it's just letting you know what's still outstanding, what you've charged versus what you've collected.
Okay, so let me ask you this then, the payer payment pending, or actually pending payments. This is showing the claims that should have been generated, some of them not.
These are all things that have actually been generated, but you haven't collected for them yet.
Oh, so
you've submitted them, but you haven't received payment.
Okay. Okay.
And then here, this is letting you know, oh, you've got one encounter. That's one encounter that's been released from the electronic health record that you need to bill for. And that's actually going to launch your process with us. So you can easily come here, you'll click on the dental form that you want to bill for. And because you're using our electronic health record, everything's going to be fully populated here. Now, if you, for whatever reason, don't want to bill it on a dental form, you can use our CMS 1500 form as well. So just depending on who you're submitting to, that might change it. But whatever you select, it's going to pull over from the electronic health record, and all you have to do here is click Send Claim.
Okay, and that's being generated, that can be generated by the front office staff, our billing staff?
This is actually generated from the note that the provider took. So when the provider takes a note in our electronic health record, we capture that data and we push that data into the billing.
I see. All right. Okay, good.
So all you do is click Send Claim. It will electronically send that claim to the clearinghouse. And the clearinghouse is going to actually update the status of this claim within 3 hours. And you can keep track of it from the pending tab, meaning it's been sent. We'll let you know when it's resolved, canceled, if anything rejects. You'll have full insight to everything that's happened with that claim in the Claims tab.
Well, it says here on the right-hand side, Run Report. Is it Run Report on just this claim?
It's not just that claim. It's actually going to be for all of your claims.
Good, good, okay.
And I'm going to just pause my screen share for a moment because I have an account that's got a little bit more data in it that I think would be helpful to show you so you can kind of see everything in action. So I'm just going to toggle into a different account with a little bit more data.
Okay.
So here we are. We're still in the Claims tab. But what this allows you to do is say, okay, I want to see all of my claims since January 1 of 2016. When you run this report, it's going to change the results based on the criteria that you've selected. And so you can actually see all of your claims that have rejected since January 1st, 2016. And all of our reports are exportable. They can be put into an Excel file or to a PDF file. So you can really get an insight as to what's going on with all of your claims.
Oh gosh, that's great.
But once a claim successfully goes to the system, you'll get a payment through an ERA. Again, it's just electronic remittance advice. It's very similar to the EOBs that you're used to receiving. But the main difference is that we actually allocate those payments electronically, and we allocate 100% of that payment. So instead of having to manually try to figure out what date of service the payment's for, we read that electronic remittance advice, and we'll just apply it across the board so that all you have to do is review the payment. And there's a little button that lives right to the left of the attached document button, and it says Print ERA. When you click on that, it gives you a PDF pop-up of the EOBs that you're used to looking at. And if everything looks good, all you do is click Save and Post.
Oh, wow.
Now, if you ever have a problem with the payment, you can always click in and say, oh, you know what? On 4/6/2017, patient Tom Johnson, I don't agree with the allowed amount for this line item. You can actually leave that line item open and go back and, you know, fight with the insurance company over it if there's ever something that you don't agree with. But if everything looks good, there's no reason to drill into the detail. Click Save and Post. When there's a secondary insurance, we automatically queue that up to the patient's secondary. When there's not a secondary and the patient's the next responsible party, we know that when this box is left unchecked. When you click Save and Post, we update the balance to patient responsibility and will automatically generate statements.
Okay, so let me go back just a little, Jessica. So we already established that the system won't pick up from the state, that there's a secondary insurance. We have to put that in there.
Correct.
So once we put that in there, so what you're telling me is that the clearinghouse will pick it up after that?
So once you put a secondary into the RxNT system, we know that the patient has a secondary. So when that payment comes in, we know that there's somebody else that you can bill before billing the patient that might submit payment.
Okay.
And so we automatically check the Enable Requeue claim box when a patient has secondary insurance so that we can send a new claim to the secondary insurance.
Okay.
And then when we don't see a secondary, there's nobody else for us to put the responsibility to, so we queue it to patient responsibility. So when you click Save and Post, we update the patient's balance.
I see. Okay.
And I'll just go ahead and kind of sidestep our workflow for just a moment into the statement section. These will run automatically. So you can have them run monthly, weekly. You could set it up so that they only run if a patient owes more than $5 or $500, completely up to you. But here's an example of a statement. They're very clean and concise, easy for someone to read and understand.
So do we have to ask the system to generate it, or does it automatically generate?
So when you get set up with RxNT, we're going to teach you how to set up a cycle so that it'll run how frequently you want. And once that's set up, it's going to automatically run indefinitely.
Okay.
So we just need to know how frequently you want it to run, pretty much.
Okay. All right. Fantastic.
We do have an online patient bill pay functionality. There's no additional cost from our perspective. Now, we do work with a third-party processor, Sage. They do charge a fee, but you could figure out that price. You basically tell them your volume, and they provide you a processing fee quote. When that gets processed, that payment will come in electronically just as an ERA would. So you can easily review it, save and post, and it's just a really easy way for patients to make payments.
Okay.
Any questions about the billing solution?
No, not yet. No.
Okay. If the payment does actually come in via check, or maybe you didn't collect at the time of check-in, you can always add a new patient payment just by clicking New Payment. It's going to look just like the payment does in the insurance screen, but most of the time our patient payments are collected either through the scheduler or through online patient bill pay.
I see. Okay. So it's going to register whatever we input into there.
Yeah, exactly.
Okay.
Do you think a billing solution, that 4-step process from receiving the encounters from the medical record to tracking claims to your insurance payments and patient payments, is that something that would be, that your office would be comfortable using, do you think?
I'm pretty positive of that. I'm pretty positive. We do through Delta Dental. That would be helpful with the claims for sure.
And if you have self-pay patients too, that's going to be easy. We can just automatically generate statements there.
That's great.
So we've kind of covered the entire workflow. I know we've covered a lot, from scheduling to the electronic health record, e-prescribing, to the medical billing and dental billing component. Anything else that you'd want to see?
Yes, actually, I'm glad you asked. We need to provide a patient portal connection.
Mm-hmm.
Can we do that through RxNT, or do we have to?
Of course.
Okay.
So going back into the electronic health record, I just switched tabs here. Under the menu button, we have Generate PIN. And this is actually just going to, this patient already has one. But what this allows you to do is actually generate a PIN number so that when the patient logs into their patient portal for the first time, I'll just show you how this works. They'll go to rxnt.com and click on Patient Login. And when they do, they'll just click to register. They'll enter their first name, their last name, their date of birth, and the PIN number that you've provided them. And when they click register, that's actually going to give them access to the patient portal.
Oh my gosh, that's fantastic. Really.
Any other questions?
No. Is there a demographic or a demo that will show what the patient sees when they get into the portal?
I can try to.
Yeah.
I can get in if you give me just one moment.
Okay.
Okay, so I am now in the patient portal. And what you're seeing here is kind of just some generic information to start. And the menu tab here is going to let them see any profile information, demographic data. They can also see any medication information that they're actively taking or that you've sent to them, allergies. So it's just a kind of a quick way to see what's going on. And also from here in the message tab, they can actually send you messages. So if they wanted to compose a message to the doctor, they could do that. And they would just, since there's only one doctor in this account, so it'll show up. But
so let me ask you this then. Jessica, can those be routed to the front desk so that we're not inundating our doctor with a bunch of messages from patients?
They can. So kind of going back to the electronic health record, this message section up here is actually where the messages will be received.
Okay.
And you can determine how you want to have those basically being reviewed. The other thing too is that the doctor doesn't have to check them. You can let him know when he's got a message that requires information.
Yeah, now, and we can forward those messages to him, or just sending, how do we?
You'll just need to let him know. Those messages don't get directly forwarded.
I see.
We are enhancing the patient portal, so it'll have a little bit more functionality, and I think it'll just be a little bit more sleek and kind of look, well, it'll just have a better ease of use, I would say, kind of from an overall perspective. And so you'll obviously get access to that benefit as that enhances. I don't have a timeline on the new patient portal that's being released, but you'll have some new features like that. But in the meantime, you can receive those messages. It certainly is going to help you from a meaningful use perspective.
Yeah,
and then you'll just let the provider know.
No, that sounds great. The fact that that's available is very helpful.
And we'll keep track of every time you generate that PIN from a reporting perspective so that you know exactly what you've done as far as how many times you've given a patient access.
Okay. The only other thing I wanted to ask about the portal is that most portals have a function where the patient can request a scheduled appointment. I noticed you had a scheduling tab on there.
We do, and that's for current appointments.
Okay,
we are going to have the request function come on, but they're basically going to request you for an appointment. It won't schedule an appointment, and that's actually coming with the new release of our portal that I was telling you about.
Yeah,
in the meantime, we just recommend that patients send a message to you requesting that appointment.
Actually, I've had experience with that where they were working on the portal, where patients could schedule their appointments, but it was causing major issues with the front desk. So it's okay if that doesn't happen.
And we've heard that too, and that's why we don't want to allow patients to schedule their own appointments. We hear people talking about it, and the doctor's office that I even go to, they had it turned on and they ended up turning off because it was such a hassle. They couldn't even use that functionality. So we're only going to allow for the request of the appointment. We won't actually be making those schedules.
That's fantastic. Actually, that's really good to hear. So is there well, that's what I was going to ask you, if there was anything else on the portal that we probably needed to see.
I don't think so. I mean, it's pretty straightforward.
Can the patient print their information from the portal?
That's a great question. Let's see here. I'm going to go to the clinical summary for the patient. I don't know if it's a true print, but they could certainly right-click and print.
Okay. All right. No, that's all right, though. I just wondered. Wasn't that it was required one way or the other. Just my own experience using the system, so.
Yeah, no, it's a great question, and I can certainly look into that further. I don't see a print button here, but you can always print screen.
Oh, that's fantastic.
Or print the document.
And like you said, that this is HIPAA compliant?
Yes, it is.
Yeah. All right, that's also the big deal too.
It is, and all of the data storage and everything is, I think I mentioned, housed by Hostway. So that's actually where the data will be stored. And they also comply with all those regulations and all the components necessary to make sure the data is secure.
Okay. Okay, and then I just had getting away from the portal, because that pretty much answers my questions with the portal. Just one more thing about our XNT system, the EHR. If the front desk wanted to get a message to the provider,
Mm-hmm.
will the system send a message to the provider remotely?
So you could leverage tasks. So if you wanted to create a task for something that you wanted the provider to actually do, basically you would just select a task type and you would just choose to assign that. Now I don't have it set up to actively assign tasks any longer in this particular example, but that's exactly how it would work.
Oh, no, that actually would work.
Or the messages too. You can also send internal messages if you wanted to.
Okay. Because I know that he's not always on location here. And so sometimes it would be nice to be able to get stuff to him.
Exactly. So all you need is access to the internet, and if you have access to the internet, you can access all of your messages, any tasks, everything, right from RxNT.
All right, fantastic.
Any other questions?
Okay, so I did have a couple that aren't related to the system, but related to the actual implementing of the system.
Okay.
Do you have the ability to give us a 30 to 60 day evaluation time for our staff?
So we don't, it's not like we don't have a free trial or anything like that. Okay. And the biggest reason for that is because once we set up the billing component, that does take about 3 to 5 weeks. Yeah. And we have hard costs associated with getting that set up and getting you successfully using it. So we don't offer free trials for that reason.
Okay, that's right. I just needed to ask. And then the other one I wanted to ask you was, what is the pricing per month?
So for the full suite, everything that I just showed you here today, the scheduling, the electronic health record, the e-prescribing, and the medical billing is available at $205 per provider per month.
Okay.
Now, if you guys decide that you wanted to use electronic prescribing of controlled substances, that is $25 per provider per year. So it's not a monthly fee, it's an annual fee. And then there are 2 one-time fees associated with the DEA requirements for controlled substances, one of which is $50, that's 50, and that's for identity proofing. It basically is the DEA needing to confirm that you are, in fact, who you say you are from the provider's perspective. And then once that's complete, we'll actually ship you that token that I showed you on this screen. And there's a one-time fee for that of $15.
Okay, and is that done through you, or is it done remotely through the DEA?
It's all done through us. What you'll do when you actually log into RxNT for the first time, under the Utilities tab in the top right-hand corner, there is an Activate EPCS button. So you'll just click on that Activate EPCS button, and that will launch the ID proofing test. Okay. Once that's been successfully completed, we will get a notification, and that's when we'll actually ship you the token.
Okay, fantastic. Now, is it an extra cost for the token?
So it's all included in that that fee I just kind of quoted to you. So the EPCS, or electronic prescribing of controlled substances, is $25 per year. There's the one-time ID proofing fee of $50, that's 50, and then the one-time token shipping fee of $15, 15.
Okay. Now, is there a base cost to start using the system, or is it?
There's no startup fees or any implementation or training costs. So that's everything. Now, if you wanted to do patient reminders or appointment reminders, there would be the fees that we talked about earlier. But other than that, it's all inclusive.
Okay. All right, Jessica, that's fantastic, and I really appreciate your time. I do. So how can I give my provider access to this recording?
So what I'm going to do is I'm actually going to convert this video. It'll convert overnight, and once it does, I'll just drop it into a link, and I will email that link to you. It'll have a password for the provider. Let me go ahead and just confirm the email address to send it to.
Yeah, and if you wouldn't mind, if you could attach any literature or or user guide that you may have available, so that he could take a look at that too, because he's the final decision maker.
Of course. I'll just kind of pack it with information. And so that'll be coming to you tomorrow, because the video does take a little while to convert, so that I can send it to you, but I'll send you a bunch of information tomorrow, including pricing. I'll put that in writing
That would
too.
be really great. Very appreciated. Let
me just check the email. So for the email, I have aspenOms@hotmail.com.
Yes. Can you send it to 2 emails? Is that a possibility?
Of course.
The second one I'd like you to send it to is Stead, STEAD, OMS, at Sprintmail.
What was that?
Sprintmail.
Could you spell that for me?
Yes, SP as in Paul, RIN as in Nancy, TMAIL.
Okay, so let me just read that back to you. And I'm having a hard time hearing you, so I'm sorry about that, but I think I heard you correctly. So it's S as in Sam, T as in Tom, EA, D as in dog, O, M as in Mary, S as in Sam, at sprintmail.com.
Yep, that's right.
Okay, perfect. I'm going to go ahead and save that, and then I'll send the email to both places tomorrow morning.
You're awesome. Thank you so much.
Thank you, and have a great day. If you have any other questions, just let me know.
Absolutely, I sure will.
All right, perfect. Have a great day.
You too. Bye-bye.
Bye.